What are the symptoms of chlamydia in the eyes and throat? Chlamydia is caused by the bacteria Chlamydia trachomatis and is mostly known for affecting the genital area. But it can also infect the eyes and throat if there is contact with infected secretions. Let's explore what symptoms might look like in these areas. In the eyes, chlamydia can cause what's called chlamydial conjunctivitis or ocular chlamydia. The first signs often include redness and irritation, making your eyes look inflamed. You might notice your eyelids swelling and a mucus or watery discharge that can sometimes be pus-like. Tears may run more than usual, and you could become sensitive to bright lights, experiencing discomfort when exposed to light. Swollen lymph nodes near the eyes are also possible. Many people describe a mild scratchy or gritty feeling in the eyes, similar to having something in your. Usually, these symptoms develop within 2 to 19 days after contact with infected secretions. The infection can spread when infected secretions touch the eyes, often through hand-to-eye contact. If left untreated, chlamydial eye infections can cause persistent irritation and, in severe cases, scarring or vision problems. This is especially important to note in newborns, who can acquire the infection during birth, leading to neonatal conjunctivitis. When it comes to the throat, chlamydia can infect the pharynx, often called pharyngeal chlamydia. Interestingly, many people with throat infections don't notice any symptoms at all because the infection is often silent. When symptoms do appear, they tend to be mild. You might experience a sore throat that doesn't go away, some irritation or discomfort when swallowing, or a scratchy feeling in your throat. Swollen lymph nodes in the neck are also possible but less common. Since symptoms are usually mild or absent, throat chlamydia often remains undiagnosed unless specific testing is done. It's important to remember that chlamydia in the throat does not typically cause severe pain or other signs typical of bacterial throat infections like strep throat. Chlamydia is often called a silent infection because many people do not show symptoms, especially in the eyes and throat. If you think you might have been exposed through sexual contact or notice any of these symptoms, it's essential to see a healthcare provider for testing. Treatment usually involves antibiotics that are effective in clearing the infection from the eyes, throat, and genital areas. Preventive measures include using barrier protection during sex and avoiding touching your eyes after contact with potentially infected areas. Acting promptly can prevent complications like scarring, vision problems, or ongoing transmission. Remember, only a healthcare professional can provide an accurate diagnosis and appropriate treatment, so if you have concerns or symptoms, don't delay seeking medical advice.